Hi everybody, my name is Anubha Bhonsle. Thank you very much for joining us here on Newsworthy. If this is the first time you're watching us, let me underline for you that we believe in news, not noise. We believe news and information must have context. It must be devoid of any conflict. This is news that's worthy of your time, your mental health, and your attention. Today on Newsworthy, I am bringing to you something that's of extreme significance, extreme importance, and really in public good. COVID-19 vaccines and pregnant women or women who are breastfeeding or lactating. Should they be taking the COVID-19 vaccine? Well, government guidelines as far as COVID-19 vaccines and women who are either pregnant or breastfeeding is very, very clear. Government and in fact both vaccine manufacturers have exempted pregnant and lactating women from eligible beneficiaries. What does this mean? Well, this essentially is simple. It means pregnant women and those who are breastfeeding should not be taking either of the COVID-19 vaccines here in India, whether it is Covishield or Covaxin. Before I bring in the experts here, let me add that clinical trials for both vaccines did not include pregnant and breastfeeding women. And there is, at this point in time, little safety or efficacy data on how COVID-19 vaccines may impact pregnant or lactating women. So you would ask, what is the problem? What is the confusion? Well, the confusion or a slightly messed up communication is stemming from several doctors giving different opinions. Let me start with what's called FOGSI. It is the Federation of Obstetricians and Gynecologists Society of India, and FOGSI, in a rather large and laborious PDF, has recommended that healthcare providers be allowed to administer COVID-19 vaccines to pregnant and breastfeeding women. In fact, I'm quoting them from the PDF. They're adding that with preparations to manage adverse events. FOGSI has gone on to say that benefits of vaccinating pregnant and lactating women far outweigh any theoretical and remote risks of vaccination. In that document, FOGSI has further added that until there is change in official government guidelines, healthcare providers do not, should not, and cannot advise vaccination for pregnant and lactating women. Well, the situation as I am sensing it, as I am reading, as I am getting through information and speaking to a whole host of doctors is slightly different. A growing number of doctors and medical experts are challenging this government guideline and in cases recommending that pregnant women take the COVID-19 vaccine. I personally and the Newsworthy team has spoken to at least 6 doctors across different states who are recommending the COVID-19 vaccine to pregnant women who may be in different stages of their pregnancy. What is the need of the hour? The need of the hour is to obviously clarify the situation and a clear-cut government guideline and instruction for medical practitioners and of course for pregnant women, lactating women and their families. This is really the context, and add to that is the WHO guideline, which has said that pregnant women do have an increased risk of developing severe COVID-19. I'm not the expert here, and I am going to rely on Dr. Nozer Shehryar. Let's patch him into our feed. He is a practicing obstetrician and gynecologist. He's been the former Secretary General of FOGSI, the organization that I spoke of, and he's someone who's a really strong and expert voice in public health, especially women and reproductive health. Dr. Nozer, thank you very much for sparing time. I see you are in your scrubs, so an even bigger thanks for sparing time and talking to us about this very important issue.
Thank you, Anubha, and thank you so much for taking up this subject, which has created a lot of doubt and confusion in the minds of both the profession and women, and we need to have some very clear thoughts and ideas on the subject.
Dr. Nozer, I think it would be really beneficial for you to sort of start off by saying that what is the government guideline and position as of today?
So we have a very clear position, and the government has restated this in a communication on the 6th of May, where they have categorically said that the vaccines we have available in India are not to be administered to pregnant and lactating women. And they have stressed that both the manufacturers in India have actually put this as a contraindication to the vaccine. Uh, as you rightly said, unfortunately, there is a lot of confusion because organizations that speak up for women have given varied opinions. I agree that the WHO has given an advisory, which is an advisory, but we, at this point in time, do not have clarity, and we need to wait for more scientific evidence to build up. I can tell you a colleague of mine who sent her patients to a certain center where they were turned back. They were very upset because they were told that they can't be vaccinated because they were pregnant. And this colleague called me up all upset saying, but the FOGSI guidelines said that we should advise vaccination, and that's not true at all.
FOGSI's recommendation, as I read out to our viewers, is sort of fairly clear. They are of the opinion that healthcare providers should be given this mandate to suggest COVID-19 vaccines for pregnant women and lactating women. They've added a further caveat that till actually the government says so, you can't be doing that. But Dr. Nozer, I mean, for an organization like FOGSI, which is, whose opinion a whole lot of practitioners are going to take, I'm wondering how can we expect doctors in different corners of the country to understand this particular guideline with all the nuance that you're suggesting?
So the guidelines are kind of descriptive, and maybe the good thing about the guidelines is that they are putting the available vaccines and the other vaccines that will come in perspective. But if you read the guidelines on page 8 very categorically in the current recommendations on COVID vaccine in maternity care in India, FOGSI clearly says that individual practitioners cannot advise the vaccination to pregnant and lactating women in India until there is a change in recommendations from the ministry and the government of India. So this is there, absolutely. It is there in italics. This is there. Unfortunately, what people are reading is what FOGSI's position statement is, which is based upon what they've seen in the advisories by the ACOG, that's the American College, the Royal College, and the WHO. Now, I'll just give you a bit of background to it because the Royal College actually was recommending this, and this was quite a talking point. And the success was that the UK has now uh, allowed vaccination. Initially, it was only to the healthcare providers and the frontline workers, but they've now recommended to all. But if you really read what the Joint Committee in the UK has said is that they have said that clinical trials in pregnant women are just starting, but there is real world data of about 90,000 pregnant women who have been vaccinated mainly by the mRNA vaccines. Neither of our vaccines in our country are as of now mRNA vaccines. So we have taken a part of that particular statement. In fact, some of the language from the ACOG statement comes into maybe our statement. But we need to be very clear that what ACOG and RCOG presently are recommending is that a different kind of vaccine, which hopefully will be available to us in future, is probably the one that has been tested. Will the other test vaccines be approved? Maybe they will. I would wait for scientific evidence. We've always given the privilege of safety to women who are pregnant and women who are lactating and babies and infants. Please remember that we are not giving this vaccine anywhere to a child as of now. When you're giving it to a lactating woman, she is dealing with an infant who is constantly taking from her. So I think we need to be a little more balanced and judicious. I am just taking phone calls like every doctor every day from anxious women who've seen it on social media. I'm getting phone calls from women who've been told by their pediatricians that please go and take the vaccine. It is recommended by WHO. And I think somewhere we have got it wrong. What concerns me is that some of these women will go to a center, not inform the center that they are lactating because you can't tell, nor inform the center that they have an early pregnancy. And even there, the recommendations overseas say that maybe we need to be judicious in the first trimester when the woman doesn't look pregnant at all. And in that situation, we may give them a vaccine. Is this harmful? Honestly, at this point, we don't know. And we have no right to put a woman at risk. To say the woman gets to take a call on this one is shifting responsibility. It is our responsibility to tell her whether it's safe, whether it's tested, whether it's approved. We go that extra mile during pregnancy to make sure whatever we administer a pregnant woman has a certain level of safety. And this bar is much higher than that for general population. So I believe we should wait. What do we do in the interim? I tell my patients, you will be the first to know when the recommendation changes. I'm going to line all of you up at that time. The second thing I want them is that even if you were to land up at the center, my concern is exposing that woman. You've seen the sites at the centers of people waiting to get the vaccine. Do I really want to send that patient out there to be with so many people, often without social distancing, when she's in a bubble at home being protected? What I recommend to her is why not just get everyone around you in your house who's eligible be vaccinated? So you create your own safety bubble. And as such, after the vaccine, all your precautions have to continue any which way. So I think a slightly more judicious and balanced approach is what we need. Again, I should be fair and stress here that people read what they want to read in a document.
Yes.
And again, the FOGSI recommendation is clear, no vaccinating at this point. The
Yes.
FOGSI position statement says women are at risk. At some point in time, we are going to have to give them the vaccine. But I think this should wait for some very solid and clear scientific evidence. One last point here, and I don't want to sound the alarm, but you know that there have been some concerns about the certain vaccines as far as thrombosis is
Yes.
concerned.
Yes.
Very rare, very few and far between. There are cases that are challenging this. Pregnancy itself is a thrombotic state. Post pregnancy, after delivery, a woman has a higher risk. So maybe we need to look at different vaccines and decide which is the vaccine that we would recommend for pregnancy as and when they are available after the government, the ICMR, and the ministry give us a very clear guidance. As of now, please, doctors, please, women, just hold your horses for some time. Uh, uh, let's just be very, very safe rather than sorry after some time.
Okay, I think you've put it out absolutely. You've articulated it perfectly, Dr. Nozair, and with great clarity as to what you believe. I spoke to a couple of doctors. I did speak to a couple of women, and this is sort of the crux of either the recommendation being given by doctors or what the women are hearing. The general recommendation, one of the women said to me that her doctor has told her, is that it is better to get the vaccine than get COVID, but be aware that there is no data. If a message like this, or a recommendation like this, or an advice like this is given by a gynecologist, we are almost saying that this is an individual decision, that the pregnant woman needs to take an individual decision as to what she believes is the greater risk. What is wrong with this kind of messaging?
So I know I'm a strong believer in choice, and I'm a strong believer in women's right to decide whether to take something or not to take something. But this cannot be devoid of the science. Our patients are looking to us for a clear guidance. You can't just say, you decide whether you want to take it or not. If it's good, it should be a strong recommendation for. If we don't know, we have to stand up and say, we don't know as yet, let's wait for some time. Now, regarding COVID in pregnancy, I will tell you that yes, we have been through different types of presentation in the first and the second wave. Uh, we had a lot of patients in the first wave. Yes, there is definitely risk of hospitalization, risk of critical situations, but by and large, COVID has not been unkind to pregnancy. And I keep reassuring, because this is the time when women are mentally, extremely in an anxious state. They are worried about themselves, their pregnancies, their family members. And my basic message to women is, unlike a lot of viral infections in the past, COVID has generally been kind to pregnancies. There's no evidence of creating birth defects. There's no evidence of increased miscarriage, or at least as of now, that's what studies say. There is very little maternal to child transmission. Mortality because of COVID in pregnancy, thankfully, is being reported, but is still low compared to, say, what H1N1 did. So at this point in time, give the patient the message that this is a disease that you need to be careful about, you need to protect yourself from. For God's sake, this is not the time to holiday in Goa or Maldives or Dubai. This is not the time to step out of your bubble, and make sure that everyone who's around you is also equally responsible. And this is not also the time to be, too paranoid. Make sure that your provider is there for you, is available to you, and that you will be looked after, whether you are negative or positive at the time of delivery.
I want to just delve a little bit on the FOGSI discussion, because I did have a communication and a conversation with people who were deliberating on this. And one of the things that was said, that there is a caveat that FOGSI has put, but it is not contraindicative, because there is no data either way, and that's why FOGSI believes at this point in time that the government should come forward and allow medical practitioners to recommend this, and they will keep, if there is an adverse event, they will be prepared for that.
So, do we have the right to wait for adverse events and then report them, when we are ourselves saying that there is no data either way? I believe that we should wait for data to build up. We should allow some control studies to be done, as are done for every different type of age group and ethnic group, and we need to wait for that to come. We've always been so judicious in pregnancy before giving any medication. We know from past history in pregnancy the disasters that medical practices had, when certain drugs had consequences which presented years later. I mean, everyone knows about certain drugs which caused major birth defects, and they were being used, but we only realized later. So my position is, FOGSI's position is, uh, be patient, wait for a recommendation. Yes, we will push the authorities to kind of look at this closer. Science, as far as COVID is concerned, is racing ahead. Everything is being done in fast track. We already have all these cases from the US to learn from. And let's be a little patient, because from what we know, that we may have an mRNA vaccine available in our country soon. We may have some data building up on the two vaccines we have. Maybe one of them is going to be better than the other one. I don't know, but it goes to
But you
research.
don't
Each
believe at
vaccine
this
will be
stage,
different.
Dr. Nozia, Dr. Shariar, that the benefits of taking a COVID-19 vaccine outweigh potential risks of taking a COVID-19 vaccine
So, so
for
I,
this
I, I,
vulnerable category of
yeah.
pregnant
So
people?
I don't believe that the benefits of the COVID-19 vaccine outweigh the unknown risks of the COVID-19 vaccine. We don't know what the COVID-19 vaccines would do, considering there are many different kinds of vaccines. Yes, there is solid evidence building up for the vaccines in the US, and we've got lessons to learn from them. And that lesson can probably be, it's been translated in the United Kingdom, and maybe it will be translated to India. And I will be very comfortable in using a vaccine that has been used by large numbers of pregnant women, and shown no major adverse effects. But to say that let's use the vaccine because the benefits outweigh the risk, and then we will do a registry and see what complications turn up and deal with them later, I don't think that's generally the way science and medicine works.
Dr. Nozar, I thought of this and I was wondering, we have two COVID-19 vaccines in which both the manufacturers and the government has said that pregnant women and lactating women are not eligible beneficiaries. But surely our vaccination started in January. Surely we have a sense of the number of pregnant and lactating women in this country, and at some point in time they would need to have a safety vaccine. Surely, I'm just wondering, didn't anyone think that this vulnerable population also needs to be protected? And if your own vaccines are not, and you don't have clinical trials and efficacy data, and there are other vaccines abroad, shouldn't have there been sort of fast track approval for that so that this vulnerable population also has a vaccine to go to?
That's right, but fast track approvals based on what? I'll just remind you that manufacturers, regulators are extremely reluctant and careful to test anything on a pregnant woman. And in fact, when it comes to most drugs, they would be at the end of the line before we come up with a safety recommendation. I understand that there might be inadvertent administration, and maybe we need to look at those, but our country has mainly vaccinated the elderly to this date. We've just moved on to the next generation. So as of now, I don't even think we've got enough numbers to analyze the inadvertent use of vaccine in pregnancy. So again, my basic position here is, Anupa, very clear. I mean, you can't be clearer than that communication from the government. Very clear position taken by vaccine manufacturers. How then does the caregiver take the responsibility of recommending something? We do off-label administration of drugs when we have no other alternative or choice, when we are reasonably sure of its safety. How then do we make this recommendation? And even worse, how then do we kind of lob the ball into the woman's court and say, you decide, and kind of keep ourselves protected by saying, I just gave her a choice. She decided that she wanted it and she took it. Well, that's not the way that science and medicine should be working. I think women are looking to us for a recommendation. Let's have clarity. Let's wait those next 2 or 3 months. Let women be as safe as they've tried to be in the last 1 year and few months. Let them continue to do so. Let them create safe environments. And when time comes, and if the vaccine is approved and tested and proven, then we can absolutely go gung-ho. We do a lot of vaccinations in pregnancy. We do the influenza vaccine in pregnancy. We do the tetanus, the Tdap in pregnancy. This will take its position alongside those vaccines for each and every pregnant woman. We won't even have to wait for lactation.
Okay. Just final two questions, Dr. Shariar, and you can keep them as succinct as you want them to be. What would you say to doctors who are disagreeing with you at this point in time and believe that the risks of COVID-19 or getting it are far greater and outweigh any potential risks of the vaccine? What would you say to them?
So after having a large number of patients of mine, even in private practice, I've looked after, and having one patient who presently is critical in the ICU, and every day I'm just thinking about what we could have done to prevent that, I would still hold that doctors have a responsibility to follow evidence. Doctors have a responsibility to follow clear-cut guidelines. We can always have a wish list we want for the future. We can always push the authorities, the organizations, the companies to give us something more for women. But until that's forthcoming, opinions, experiences, anecdotal reports have no place in clinical practice. Our responsibility is just too great because we are dealing with someone else. And if we get this wrong, we don't someone else pays the price. So let's just wait for a little while. Meanwhile, make up by giving that woman all the possible emotional support. Be there for her, be reassuring for her. Since the start of the pandemic, India has probably had what, 27 million births? That's how many we do in a year. We did those without a vaccine last year. We did not see that kind of a dramatic rise in morbidity and mortality, though we all know that there have been cases, and maybe in some situations, some hospitals are seeing these problems, and we need to have systems to look after these women early and when problems happen. But but let's continue to look after those women, teach them how to make their environment safer, teach them about following all those practices that we know work for COVID, and promise them that the day evidence shows that the vaccine is something that's safe in pregnancy, call each and every woman you look after and everywhere in the country, and then you fast track their vaccines. I mean, put them right in front of the line, give them a separate line, give them separate centers and do it for them. But till then, let's just be a little more patient and wait for more clarity on this issue.
I should have asked this somewhere in the middle, and this would be the advice no matter which stage of pregnancy, no matter if you have got pregnant, no matter if you've taken the first dose and then got pregnant, you would believe that this is the advice to hold true for all women who are either pregnant or lactating.
That's right. That's right. Again, pregnancy does have certain times in pregnancy which are considered to be more vulnerable than other times. And I just go from experience of all other vaccines that you normally leave the first trimester alone, because that's when every part of the baby's body, every organ is forming. It's called organogenesis. So I believe that when time comes, we probably might leave the first trimester alone. I don't know. It would have to come from science again. And probably what happens to most of us now is even the other vaccines we used to use, the influenza vaccine, which does have an H1N1 component in it, we usually do recommendation, as has been for the ACOG, has been for the RCOG, as FOGSI is kind of put it out there and said, do not vaccinate, but we believe that vaccines would benefit. And maybe the first mRNA vaccine that comes into our country might be the vaccine for which the recommendations will change.
Fair enough. Dr. Nazair, thank you so much for clarifying every bit of this confusion, of this conundrum. As I mentioned before, Dr. Nazair Shehryar is a practicing obstetrician and gynecologist. He works in public health. He's been a vociferous exponent of women's reproductive health and choice, but this is his valued opinion on this aspect. The COVID-19 vaccines available currently in India should not be, as government guidelines and manufacturers have said clearly, should not be administered to pregnant women and lactating women. Dr. Nazair, I really appreciate this. Thank you very much for your time.
Thank you, Anubha. I think you couldn't have been more clear than the summation that you made. Thank you so much.
Thank you so much. Well, if you have any more questions or are still confused about this, you can drop them in the comments section if you're watching this on Instagram or YouTube, and we will make sure that you get an answer to this particular question. If you've been watching, thank you for your time.